Are you diabetic and wondering what might happen if your diabetes progresses? Let's examine 6 common complications of uncontrolled diabetes. Coming up. This channel is about tips and advice to promote your health and to keep you young. And if that's what you want, hit the notification bell and subscribe. Before I start talking about diabetes complications, let me just explain the difference between the 2 types of diabetes, type 1 and type 2 diabetes. In type 1 diabetes, your pancreas cannot make insulin or makes too little insulin. In type 2 diabetes, the body cells do not respond to insulin, or your body cannot make enough insulin, or it is a combination of both of the problems I mentioned earlier. Insulin is a hormone produced by your pancreas and moves the sugar from your blood, like after a meal, into cells where they can be used as energy. You can think of insulin as a key, helping glucose into these various cells. Now, what happens in diabetes is your body fat cells, liver cells, and muscle cells do not respond well to insulin. This is called insulin resistance. Your pancreas ends up producing more insulin to try to push sugar into your cells, but it reaches a point when it can't keep up and there's too much sugar in your bloodstream. How do you diagnose diabetes? Well, 3 common ways. I have the units listed, also used in other countries like in the UK in parentheses. 1. If your fasting blood sugar is 126 milligrams per deciliter or higher, if you have symptoms of diabetes such as fatigue or urinating more, feeling thirsty, weight loss, blurred vision, and a random blood sugar of 200 milligrams deciliters or above. And 3, if you have a blood test called hemoglobin A1C and it's 6.5% or above. This value measures your average blood sugar in the last 3 months. If you've been diagnosed with diabetes or recently diagnosed with diabetes or dealing with diabetes, it can at times feel overwhelming and frightening. Diabetes is also called a silent disease, as you really don't feel diabetes, but it can lead to serious and life-threatening complications. What are 6 common diabetic complications? 1. Cardiovascular complications. If you're a diabetic, you are at an increased risk of cardiovascular disease and its complications. This is because diabetes affects your larger vessels and your smaller vessels with plaque formation and atherosclerosis. Blood flow and oxygen supply to major organs are affected. This can lead to problems like heart attack, stroke, or even death. Number 2, eye complications. You are at an increased risk for cataracts, glaucoma, and vision loss. One of the reasons which can lead to vision loss is a condition called diabetic retinopathy, where the tiny vessels perfusing the back of your eye are affected, causing them to leak fluid or even blood. 3, foot complications. Diabetes can decrease blood flow to the feet and damage the nerves that carry sensation. Because the nerves are damaged because of the lack of blood flow, this is called diabetic neuropathy. This can affect the way you perceive pain, and you're at an increased risk of open wounds, fungal infections, foot ulcers, and callus formation. You might step on a piece of glass and you might not even feel it. Moreover, if the blood flow to your lower extremities and feet are severely affected and your wounds do not heal because of poor circulation, you are at an increased risk of infection and at an increased risk of loss of limb and digits. Yes, I'm talking about amputation. Number 4, kidney complications. Diabetes can harm your kidneys. This is because the blood vessels in your kidneys, as well as the tiny blood vessels supplying the filtering units of your kidneys, become damaged. Over time, because of high blood sugars, these vessels become narrower and clog up. Number 5, I'm going to clump all comorbidities together, especially hypertension. Given that diabetes is a systemic disease, it is associated with many other comorbidities. I'll only list some of them as this video will become too long, but you should be aware of these conditions. These are hypertension, obesity, hyperlipidemia, hearing impairment, sleep apnea, fatty liver, gum disease, memory problems, depression, eating disorders, anxiety, and even fractures. Although like diabetes, you can't feel hypertension, high blood pressure stresses your cardiovascular system and increases the progression of complications to your eye, kidneys, and your brain. And in this way, diabetes increases your chance of diabetic retinopathy, kidney disease and kidney failure, and a stroke. Number 6, diabetic ketoacidosis. Well, what does this mean? This condition can happen in type 1 diabetes and type 2 diabetes, but more likely in type 1 diabetes. Here, chemicals called ketones build up in your blood and make your blood more acidic. This is because if insulin cannot be made by your pancreas, the body is not able to use up sugar. If sugar cannot be used as a source of fuel, fat is used instead. Burning fat produces ketones. However, if too many ketones are made, it becomes toxic for your body. If you're interested in how to tackle these diabetic problems, click on this link above in a future video. And here is a playlist of videos looking at the most common diabetic medication, metformin. And if you want to follow me on TikTok, where I upload daily, check me at Dr. Think Your Health. And if you're interested in other videos, click right here, or click right here, or here, or here. Think Your Health, and have a good day. Hopefully I'm in focus. Am I in focus? Well done. Coming up, let me check, I need to check. Hopefully I'm in focus. I don't want to do the whole thing again.